Now I did this, I did this, and it was back when we wore white nylons and white shoes and everything else. It ran into my shoe. And of course it was first thing in the morning, naturally, right? So all day long. From the sugar. All right? And I had a yellow streak down my leg. It looked like I peed down my nylons. It was bad. Because it had B vitamins in it. It was really, it was bad. All right. So, I'm going to start this. Now, I've got to keep this all sterile, right? So I'm going to wash my hands ahead of time. You don't necessarily have to have gloves on, because you're not going to contaminate anything anyway. All right, so I pulled the cap off, and some of them you got to pull your finger under and pull pretty hard. This one pops off pretty easy. Trash. Now, you can take this off with your fingers, or some nurses go, okay. So I'm making sure that it doesn't touch anything. Now, when you screw this in, try and get this straight here because it's pointed. If you have it bent, you'll puncture the tube. All right? So I'm pushing this all the way in. Now, I'm going to hang my bag. And yeah, I'm kind of a shorty, so a lot of times if it's the IV pole that's attached to the bed, I'm doing the big reach. That's okay. Think of it as yoga. So, now I've got all the air in the tubing. I got to get the air out of my tubing. Now, unlike with your NG tubes, it didn't matter if there was a little air. Here, if there's an air embolism that's too big, it can cause a problem. So, with the roller clamp down, squeeze it, fill it about 1/3 to 1/2 full. As long as there's some fluid there. If you don't have fluid there, it'll keep sucking air into the tubing. This is a filter on it, just in case you're wondering. And there are 2 injection ports. There's an upper injection port and a lower injection port. If I'm hooking up a piggyback, which I'll show you in a minute, use the upper one. If I'm giving an IV push medication right into the vein, lower port. Okay? So let me run my air out of the tubing. Now when you go to do your test out and you go to count, well, let me run the air out first. This is number 1. So you got some air in there. If this is completely full, you can't count the drops. It's not going to work. Then you pinch this off. Invert it, squeeze this to get it out of the drip chamber if you overfilled the drip chamber. Okay? You got to practice with this. Now, I got air in the line. I got to bleed it out, just like a brake line. So I take my cap off carefully, put this on its side so it stays there, because let's say my person doesn't have an IV yet. I'm going to forget about that slide clamp. I rarely use it. Now with the roller clamp, I'm going to open it wide and watch running out the air. But I'm going to do it over the track. Please do that. All right? If you go, I need a little bit more air there, sucking air. And you got to practice this. You've got to be able to do this and watch to see that we're getting the air out of the line, but I don't want to lose all my medication. I'm exaggerating the height of this so you can see. Now, if I go, it stopped, didn't it? Gravity, right? Just play with it. There's a teeny tiny bit of air in there. I can stamp it up to the top. I'm not too worried about, I don't really see anymore, but you can easily do that.
You say, earlier you said you can get heparin in the top one.
This, all I'm saying is this is the injection port. If you were adding medication to a bed, it's different than a piggyback. So let's say I was to give heparin, I would draw my heparin in my syringe and inject it through here. That's different than a piggyback. All right, now I cap this. Okay, I'm ready to go. I'm ready to put that into the patient, and as soon as I get blood flashback, I'm taking that needle out, and yes, some of them have a safety guard on it because you don't want to accidentally poke yourself with a contaminated needle. Then I'm going to connect this to the IV. All right? Now let's pretend it's connected to the patient. Now, I will tell you, all right, your patient's IV is to run at 100 drops per minute. You have to turn it on to something, all right? So you got to turn it on to something. And I see there's a little there. That's all right. Get your hand off that roller clamp. When you count, you cannot be adjusting it when you count. Otherwise, you're going to change the rate, aren't you? So, get the handy-dandy watch. Count. All right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33. 34 times 4 is what?
132.
If my rate's at 100 an hour, this is too fast, right?
Correct.
And I knew that because this is about 100. So in real life, you would count it again? Does that make sense, guys?
Yes.
That's how you adjust the time. Now, for some reason, people get this in their head that they're I don't know. They're coming up with what the target rate should be and seeing if they're at it. Don't do it that way. That's too confusing. Okay? Set it to something, which gave us the hundreds, but we did. So we have this 50 cc piggyback, and when pharmacy mixes it, it'll have a label on it saying, okay, this is Ansett, I don't know, I'm making this up, 100 milligrams. So you get it out and you go through the MAR, you're doing all your checks just like anything else. Now you got to hang it. So you need that and you need your piggyback tubing. It's called secondary medication. This is the primary, this is the secondary. I do the same thing. I open it. Some are easier than others. And again, there's some pieces of equipment here. There's going to be 3 pieces of equipment here. You've got the attachment needle, you've got the hanger, you got the IV tubing. Let's do the tubing first. Again, put the roller clamp up toward the top and turn it off. Where's my piggyback? Right? See how it's a little pointy thing, so you gotta be careful not to pierce the side of it. Also gotta do it sterilely. Push it on, sometimes you gotta lose a little pressure here. Now, what I would do at this point is I put this needle on right away. Because how else am I going to attach it? I needed something to do it. This is a needleless needle. We used to use needles on this, the injection needles, and then of course you had needles flying around. People got stuck with them. So we're using this. So did you see how I opened it? I just pulled it back like that. Because I don't want to contaminate that. So the cap just screws off. And it's got a screw on there, so it locks. I simply screw it on. Now, so we can hang our piggyback. Now we got 2 issues. I'm going to put some fluid in here first. There are 2 ways that we can get the air out of the tubing. One way is take the cap off, it squeezes, and you just pull it. Okay? It's sterile. I can just open this and run through it. But I may waste some of the antibiotic that way, right? Here's another way. So if this was already hanging, and I didn't just hang it, we have to assume that this rubber stopper injection port is contaminated, right? It's been hanging there, bacteria is falling on it. You can use an alcohol wipe or a chlorhexidine. It will depend on your facility. At Hennepin now, we got rid of the alcohol. We're using chlorhexidine little wipes. Same deal. Give it some friction. Don't just, that ain't gonna cut. Friction removes it, just like with washing hands. It's the friction that removes a lot of bacteria. Now I'm going to attach it carefully. Snaps right in. Really slick. So what I can do is, don't touch the rate, because we don't want to retime it. You don't have time. Take this one. This is called the backflow method. So I'm going to open it, leave that rate as it is, and lower it. What's going to happen? You see that? The fluid went here and pushed the air out because it was lower than that. So as soon as it does, I stop.
Where did that go?
Into this bearing. Did that make sense?
Yes.
Let me run through that again. So what I did was I sterilized this, attached my stuff. 30 minutes, half an hour, sure. Because it's at 100 an hour. This is 50, it'll run at a rate. As long as I don't touch that clamp. So I simply open this guy. All the way? Yeah, all the way. If you're having problems and this one is not running, you can take the hanger and lower this. That usually does it. So now this is higher than this. So it's going to run better. Sometimes it'll do it without it. Sometimes you need to put it on a hanger. It's just grabbing. After that half an hour's gone in, we know this is going to be empty. I would come, mental note, come back, half an hour, turn this off. And if I used a hanger, I would take it off the hanger because now I've changed the level of this. That's going to change the timing. So after that half an hour, I would come in, if I had used the hanger, and take it off. Usually we just kind of leave these hangers in the room. Did that all make sense? You've got to play with it because we've got the gravity thing going on. And that's the whole business with practicing. Yeah.
When you're backflowing into the piggyback,
Yeah.
do you prime the,
Drip chamber, yes.
you do prior to backflow?
You don't have to, but I do. Otherwise, it's easy to overfill the drip chamber. And I did do that. I did do that because as soon as the air went in here, I immediately turned it off. Otherwise, you can overfill the drip chamber, and then you got to get it out. I've done it a lot, which is why I was able to do it that quickly.